Hello, everyone, and welcome to Beyond Conditions. Beyond Conditions is a forum that's centered around supporting those of us who journey with chronic conditions. We do this by sharing insights, resources, and different experiences through our lived experiences in order to support each and every one of us as we navigate the intricacies of healthcare and all towards this one goal of realizing a fulfilled and full life despite journeying with chronic conditions. So this is our season finale on this special season where we're looking at healthcare communication. And today I am doing a solo season finale and I'm very excited about it. So we did look at various issues to do with communication as we went along. And I know we started with effective communication where we looked at the foundations of communication. I'm surprised that I never got to mention this. And it did occur to me that actually one of the things that has occurred to me most of the time when I've been looking at communication within the healthcare system has been the scribbling by doctors. You know, that writing that you just scribble through in your notes. And I know that you have to take in so much as we are speaking to you and write it down. And you still have to, capture everything that we have been saying. And you have taught this through medical school. But please, doctors, as you are writing your notes, if you have to scribble, please take us through your scribbles so that we also get to understand whatever it is that you said. After all, some of this information and documents are being handed over to us, or we are having to take them through different places. It really is strange if I'm walking around with a prescription having no clue, Daktari, what I am walking around with. So please be taking your patients through your scribbled notes, especially when it's prescriptions or even referrals to another hospital or to another doctor, so that we can have an idea of whatever it is that you have spoken about us. And as we are looking through this, I'm still going to go through the things that we went over throughout this particular season, and perhaps any that came up in mind and some that you asked questions about. And then towards the very end, I'll quickly look at the policy framework. There was issues that came up that, like some of you asked, does gossip only happen at community level? And I'd like to, at this point, clarify this. Gossip also happens within the healthcare system, and that is by the healthcare workers themselves. I'm talking about doctors, I'm talking about nurses, I'm talking about lab technicians, I'm talking about the radiology department. Sometimes the communication is done in such a way that it is not as prescribed, and it's done in an informal matter. And when that happens, unfortunately, that informal communication amounts to something akin to gossip. And that is how sometimes people either receive information without clarity, or other times they will receive information that is not properly communicated, and so it is maybe punctuated or not full information. And what happens in such a case is that information is likely to be communicated elsewhere in a wrong manner. And sometimes, yes, and this happens so many times, we have been, especially within the healthcare workers, we are guilty of giving out information about patients. And as you all know, that this also happens within the healthcare workers' spaces. And this is really wrong. This is tantamount to gossip. And it is really just repressive. And it's a vice that we should shun even at the healthcare workers' level. Let's ensure that we respect people's right to privacy. Let's also ensure that we uphold and we ensure that we are not breaching consent by going out there and speaking about people's health status, health results, health tests without their consent. And I have a particular case in mind where a very senior member of society was in one of the very high-level hospitals, and we knew about his demise through social media, even before the relatives had gotten to know about this. Why so? Because someone communicated this out there. It could be anyone else. It could be maybe the workers within the hospital settings. And so please work towards guarding information about your patients so that it doesn't sneak out or it doesn't leak out to the wrong person, and that person carries it forward in such a negative way, or in such a way that is likely going to come back to hurt the patient or the relatives of the patient. So it's something that I'm just asking that we look into. Along the way, we also spoke about cultural competency. And a lot of questions were asked here. And this is especially keeping in mind that Kenya is a very cross-cultural setup. We are made up of different ethnic backgrounds. We have different communities within us. What happens when a doctor is probably having to attend to someone else, or because of an emergency, they are required to go to a hospital where they are not at the same cultural level with where he has come from, maybe because of his competencies, and this you're talking about his professional competencies. Well, in such an instance, and I think we did mention this before, that you're allowed to, number one, have interpreters who can help you communicate in the best way possible, and who can carry on the message in a way that is appreciated and understood within this particular community. So it doesn't mean that cultural competency comes first. Of course, there are so many times that health comes first, life comes first. So in such instances, then you do it in such a way that you're, number one, preserving life. Then now, every other requirements can fall under the others, because once you preserve life, it doesn't matter whether you've done it within a cultural competency platform or not. So it's just about ensuring that, number one, you preserve life, which is the first thing why healthcare workers are here. And also some of you asked me, is this all about health workers and not also an onus on patients to communicate? Well, to this I must say that healthcare service are a very highly transactional service, in that there's a lot of communication back and forth. But it does happen that the doctor or the nurse or the healthcare worker is at a position of authority. So in this very transactional service, there is some hierarchy, and the healthcare worker is at a higher level. And so a lot of times the onus is on them to even steer the communication. And that is why we put a lot of weight on the part of healthcare workers here. But still, for us as patients, it's important that you communicate everything that you are required to, and not suppress anything, especially that you're a chronic condition patient. That means you're not just in hospital this one time. You're likely going to be there again and again and again. Of course, there are instances when you will encounter a healthcare worker who will maybe be rude to you or not treat you in such a way that you are used to. Point it out. You would be surprised. You're allowed to complain about the service. You actually are allowed, and it's fully within your rights. Just the same way you're allowed to refuse medical treatment, you're also allowed to complain about a service. And most of this being done through a provider, it's all within your rights to complain about this and to raise it with a different management within that organization. So don't ever feel held back to express discontent about the service that has been given. And in particular, don't forget to raise issues as concerns your health. That is what matters most. Of course, the doctor is likely to steer the communication, but that doesn't mean that you are held back in terms of talking about your condition or about the new symptoms or these many other things. And an important aspect of the social dynamics that we're talking about, whether it's family or support systems like friends, and bringing them along to a doctor's visit, an appointment, is that sometimes they are actually very instrumental to help you bring out some of those things that you're likely not to have raised with the doctor. And so whenever you can, if you feel like it's okay with you, carry someone along to a doctor's appointment, because then you likely have almost every other issue addressed, as opposed to you going on your own, forgetting something, and then finding that you have gone home, having almost something close to wasted a doctor's appointment by not letting them know perhaps the key issue that was bringing you here or any other additional issues. So that was also important that I bring this out. Now, we will go straight to the policy framework, and I'll be looking at the policy framework from a healthcare communication perspective. So I may give you the broad system and program, but at the same time, I do hope that you will see, or you'll be able to filter out the particular issues that come from communication, if at all I don't raise them. I'll start with our constitution. Our constitution sort of safeguards our right to the highest attainable healthcare service available on the land. This is under section 43. I think it's A, B, or C, but it's somewhere there. Now, having said that, I will quickly move on to the next document, which is the Health Act 2017. 2017. Yes. Now, under this act, there are certain things that are protected and that bring into effect these particular clauses which guarantee your right, which guarantee your right to emergency treatment, which guarantee the right for a child to health care. And in this particular document, you also find that it guarantees your right to privacy. It guarantees your right to consent to medical treatment. And this, again, have been covered in a different document that is called the Kenya National Patients' Rights Charter 2013. And that document covers various aspects of healthcare treatment, and in particular reference to communication. And this include things like your right to refusing of treatment. It also protects your right to information about everything you require on whatever it is you are going through. So when you go to a hospital as a patient, you actually are entitled to every aspect of what you're going through. You know, when a doctor turns around with your file and they're almost hiding it away from you, they're doing you a disservice. They can do that maybe because they are wishing to write from a particular place, but they're not allowed to do this to hide anything from you. It doesn't matter how this needs to be communicated, but it needs to be communicated because that is information about your own health. And that's information that, should you wish to go to a different facility, needs to go with you to that facility. And you have a right to even choosing a facility and a healthcare provider, and you have a right to even a second opinion. I always say a third all the way to the nth. Nth being whatever place you feel like you have actually been attended to and you want to stop at. So when you look at our policy framework, you realize that as a patient, at any one given point when you are being attended to by a doctor, and allow me to say this because, again, I have seen this severally with even my own mother. If they are giving you medication, you have a right to know what medication they are giving to you. And even the composition, if you are that informed, if you are at that level, so that you can even know this thing contains this and that and the other, which maybe I'm allergic to, yes or no. But a doctor should inform you, a nurse, a healthcare provider generally should inform you whatever medication they're giving to you. I have had several people going to a hospital and you call them and they tell you, wameniekea dawa fulani kwa vein, or wamenipatia tembe fulani. And you ask them, iyo dawa inaitwaje? And I've had this from my mom, and she'll tell me, ni ya white, or ni ya black, okay, not black, sorry, ni ya pink, or ni capsule. Na capsule yenyewe ni red na black, yes. And when you look through the different drugs out there and their appearance and how they are sold, you find that there are so many that appear in a capsule form. There are so many that appear in red and black capsule form. There are many that appear in white form. Piriton has both a yellow version and a white version. What's this? Panadol has all this. And it's so hard for you to understand what particular drug this person is talking about, because then they were not well informed. So when you appear before a doctor, you have a right, and this is safeguarded. And some of these documents are bringing into effect some of the clauses within the Constitution that accord you certain rights. At the same time, I would perhaps need to bring this out to the healthcare providers. I know we are now going digital. And I know we are doing all these things on a digital platform. The digital platform comes with its challenges from cybersecurity, because information can easily be accessed by somebody who has the right, software and this and that, depending on how secure your systems are. And so, as you work around information, because it's key in communication, remember to use what you can to protect in the best way possible your patient's information. Because when you don't do this, then these challenges will keep arising where information has been accessed by the wrong person. I have mentioned that you are protected in terms of your information through our policy framework. I did mention the Constitution, and then I mentioned the Act. I should have also mentioned the health policy, which runs between the period 2014 and 2030. And this health policy espouses those flagship projects and all those aspirations that are included in the 2030 vision, which is our blueprint document as a country that seeks to take us to a middle-level economy by the year 2030. Some of that is being done through a certain health channel, or rather for the health sector. And then perhaps also just ensure to bring out that our healthcare system is worked out such that our levels start at the community health provider levels, and you've seen that already being done. And we are seeking to turn our nation from more of a curative nation towards a nation that mostly seeks to attend to you at the primary healthcare level. And so that works well with the 2030 vision, but still it must include all these things, including that communication is being done well. Yes, healthcare is now a devolved function. And so this is my call to you at the devolved system, and that's counties also, because you're coming in as the governments that are bringing out this service and that are delivering this service, that you ensure that the doctors working within your facilities and in your healthcare system have the right skills and competencies. And communication is actually a skill. If they don't have, see to it that you carry out something close to a refresher training every now and then to upskill them in terms of communication. So communication is broad, and communication will also be, the compliance will be assessed at regulatory level. And whenever you feel like you have been aggrieved in one level or the other, remember the medical practice has regulatory bodies happening within this nation of ours. You can be able to seek out the National Council of Kenya. You can seek out the Clinical Officers Council. You can seek out the Medical Practitioners and Dentistry Board Union. So not union, board. The union is the one for the issues to do with their employment. Yeah, so the board is the one that safeguards the practice, the standards, and everything. And if you feel like you're aggrieved, you can seek out any of this, and you can share and raise it even with different other, there's the people within society that help to bring to light, the civil societies, some of these things where we have failed in terms of our governance. And as I perhaps wrap up this particular season where we have looked at communication, remember that communication really starts with you. So communicate the best way you can. And when you feel like the communication has not been done in a way that you are okay with, that you approve of, or you feel aggrieved in one way or the other, someone has been rude to you, please raise it. Raise it, go to the highest office in that center, bring it up even on the internet, raise it with all of us, and let us actually work with you to ensuring that communication to patients is upheld and it is done in a way that respects patients and not in a way that in any way diminishes the value or the esteem or in any way the feelings, of a patient, invalidating a patient. That is actually against the initial desire to support a patient's livelihood and even to support their well-being. And as I wrap up, perhaps just to say that, remember, communication starts with you. And that means even when it's done in a way that's not acceptable, raise it. I have been happy to run us through this season, and I look forward to us continuing other different seasons in the coming weeks. I've been your host, your health advocate, and your champion for chronic conditions, Teresa Barasa. Thank you.